Whenever you cut this open, you can tell which is the right and which is the left side whenever you're looking at the ventricles down here, because the wall, this outer wall of the left ventricle is always a lot bigger than the right. So that's how you can tell this is the left side and that's the right side. So what side is this? The right side, and this is the left, right? So it might be different depending on whatever I put out there. So just keep that in mind. Like if you just saw that, that'd be left, that'd be right. But if you just saw that, that's going to be the right, that's going to be the left. Okay? Okay, so yeah, so this is the apex of the heart down here, right? Like this was a cone shape. This would be like the top of the cone, or the pointy part. And so this is going to be the left ventricle, this cavity, or this chamber. And this is going to be the right ventricle over here. And so, and then this is the left ventricle, so that makes this the bicuspid valve, or the mitral valve, or the left atrioventricular valve, which means that up in here, this is part of the right atrium, as you can see. Okay, and coming down from this valve, you can see these cords. Those are the chordae tendineae, and they come down and they attach to papillary muscles, right? So these are all converging and coming down here, so this would be a papillary muscle. Right there, I don't know if everybody can see that or not. Chordae tendineae coming down from this valve, attaching to a papillary muscle. So since these are both ventricles, and this is that wall that's dividing, and this is the interventricular septum. Interventricular septum. Well, I can already do. Let's look at this one. So actually, that's a really good example of a papillary muscle right there. So so this is the right side, right? That means this valve is going to be what? The tricuspid valve, or the right atrioventricular valve, because it's a valve that goes in between, it's in between the atrium and the ventricle. And so these little chordae tendineae coming off of there are all converging out, attaching to this papillary muscle. This is actually a cross-section through a papillary muscle right there. So papillary muscle, chordae tendineae. This is the right ventricle. This, again, is the interventricular septum. This is the left ventricle, which means that this is the bicuspid valve, again, with the chordae tendineae. And so let's see, if we open this up a little more, yeah, you can really get a good look at that valve, that tricuspid valve. And actually, if I grab this piece of chordae tendineae right there, you can see all the way up to the top of that. But anyway, so that chamber inside there is the right atrium. Yeah, the right atrium. No, sorry, the left atrium. And then let's see if we can see that right atrium in here. So the right atrium is up in here, but anyway, you might be able to, well, if you get some gloves and you just kind of do this, you can sort of see up into the right atrium. And so, and then all this muscle tissue, you'd call this myocardium. And this is some adipose tissue out here, right, some fat. And I think that's about it as far as stuff that's going to be good for identifying on the practical.
So can we see the trabeculae on
The
there?
trabeculae?
Trabeculae?
Oh, yeah. So, okay, so do you see all this? Hold on. Yeah, good, thanks for reminding me. So all this stuff in there is trabeculae. So that's a papillary muscle that all these chordae tendineae are attaching to, but all the rest of this stuff, it almost looks sort of like kind of like a spider web inside there, a spider web of muscle. That's trabeculae. All that stuff. So I think that'll be a good bit of stuff to just identify on the sheep heart. Everything else will leave to the model.
Would we identify anything from the outside of it?
Interventricular sulcus.
Oh no. Well, from the outside, no. Don't worry about that. We'll just do that on the model. But just know
Okay.
this interventricular septum.
Okay.
Yeah, but as far as the outside stuff, let's just leave that to the model.